Today we are going to cover glaucoma and how it damages the optic nerve and vision. This is my old slide deck, or at least part of my old slide deck from when I used to teach residents about glaucoma and glaucoma surgery. I thought it'd be appropriate to share with you all. So, glaucoma is a disease of the optic nerve. The optic nerve carries the electrical signals for sight from the retina to the brain. In this picture, the cornea is on the left side of the picture. That's the front part of your eye, and the optic nerve is on the right side of the picture. In its simplest description, glaucoma causes high pressure inside the eye, which damages the optic nerve, and this damage is seen when we look inside the eye. As you can see, the optic nerve on the left looks nice and pink and healthy, and the optic nerve on the right is almost excavated, like it's been burrowed out. That is loss of optic nerve volume, generally from high pressure inside the eye. As you can see from my old slides, the pressure of the eye depends upon a balance of the fluid made inside the eye and the fluid drained inside the eye. I have these newer diagrams I'm going to be using, so let's switch to those. To begin with, the eye is divided up into two segments, the anterior segment and the posterior segment. The anterior segment is filled with a fluid called the aqueous humor, and the posterior segment is filled with a jelly called vitreous. All the pressure of the eyes is generated by the fluid production in the anterior part of the eye. The fluid is made in the ciliary body and drained in the angle. We call it the angle because of the manner in which the iris attaches close to the cornea and forms an angle-like structure. This will be more evident as we move forward. The fluid pathway goes from back to front. It goes in front of the lens of the eye and forward through the pupil into the angle of the eye. In the angle is the drainage system pathway of the eye. When the fluid first reaches the drainage system, it encounters a meshwork we call the trabecular meshwork. As you can see from this diagram, the trabecular meshwork is made up of various layers. Once the fluid passes through these layers, it reaches the canal, Schlemm's canal. This is the main drain of the eye. If we go back to my initial diagram, you can see that this canal goes all the way around the eye, 360 degrees. Now, if this trabecular meshwork becomes clogged over time with age, debris, or any other reason, this canal will begin to shrivel up because less fluid is flowing through it. When the fluid no longer drains properly, the pressure begins to build in the front part of the eye. This pressure is transmitted to the back part of the eye, very much like a piston. And when that pressure is high enough and is there long enough, it pushes on the optic nerve and causes it to cave in, damaging the fine optic nerve fibers. We have lots of sensitive equipment that can quantify how much optic nerve has been lost and then measure this at each visit to determine the rate of optic nerve loss. You can see that I've circled the normal optic nerve on the left compared to the abnormal optic nerve on the right. In addition to repeated scans of the optic nerve, we regularly perform visual field tests, which are an assessment of a patient's field of vision from the very center out to approximately 24 to 30 degrees. These tests are essential in letting us know how the patient is seeing and how much visual field they have lost. The main trouble with glaucoma is that in its early stages, there are no symptoms and everything looks just fine. Very much like high blood pressure, you don't know that you have it unless it's measured and quantified. But if glaucoma is allowed to progress without treatment, the patient will gradually, progressively, and unrelentingly lose vision until it is completely gone. All current treatments for glaucoma involve some method of lowering the pressure inside the eye to put less strain on the optic nerve. The goal being to halt glaucoma when we find it so that you don't lose any more vision and keep things looking as bright as possible. Thanks again for watching. Please tune in for my next video where I'll cover the different types of glaucoma treatments available. Don't forget to hit that subscribe button.